ready?
I'm ready.
Okay. Assalamu alaikum. My name is Hamza Reed, and I am the Director of Operations here at the Multicultural Center. And I'd like to welcome you all back to our Family First Center's weekly Wednesday webinar, now presented in cooperation with ISGH, Anissa Hope Center, and Olive Branch Muslim Family Services. This webinar is presented every Wednesday at 11 a.m. The format usually consists of a short presentation followed by a question and answer session at the end, where we will field the different questions from the audience down in the chat box below. Today's topic is Therapy 101, how do I pick the right therapist and what happens after? And will be presented by Sister Shahrzad Yekta. If you do not know about Sister Shahrzad, she's always volunteered to lend a helping hand with us here on our feed. She is a licensed marriage and family therapist, behavioral health consultant, and coach with over 8 years of experience. Some of her areas of expertise include couple counseling, adolescent counseling, family counseling, trauma, crisis management, depression, and anxiety management. So without further ado, I'd like to hand it over to Sister Shahrzad.
Good morning, everybody. Thank you so much for the introduction. I'm happy to be back after a month of rest that we all had. As always, please share and like and ask questions on these videos with people who you think might find these videos helpful. I know there is a lot of different lives that we've done here on this Facebook page, different therapists and professionals who have shared their expertise. So share them with your friends and family and whoever you think might find them useful. The reason I picked this topic today is because a few different reasons, because over the last few months, I've noticed that, well, a lot of people are needing more support, more mental health support. And I've been getting a lot of the calls that I receive. I spend a good amount of time having to explain really, because so many people don't know how this process works or who they need to go to. So I find myself explaining those, very basic questions a lot. So I figured, I think this would be a great topic to just kind of cover overall. And then hopefully if anyone has any questions, they can also ask. So, what are the first steps that we need to take once we realize and recognize that there is a problem in our lives, for example, or there is something that's interfering with our daily functioning, something that is not letting us be our true selves, or something that is making us feel unhappy or feel that something going on in our life where we feel like we need extra support. We need support outside of the people that are in our lives, maybe because they're not able to really give us the support that we are needing, or if we are maybe in a transitional phase of our life. Transitions are always hard. Change can always be hard, and if we need support in that phase, and we recognize that, okay, now what do I do? And that process, that first step, is generally can be very overwhelming for someone who has never done that, never reached out for help. If you're someone who struggles with asking for help, then this process can be extra hard for you. But even if as someone who maybe really recognizes that, wants to ask for help and has no problem, this process of finding the right therapist for yourself, finding the right person to talk to, and what do you look for, where do you go, and all of that can be questions that can go through your head. Then sometimes if you have a little bit of anxiety, can kind of might stop you from going there, because that by itself, the process of looking for someone, can cause more anxiety for you, so you stop. But we don't want that to happen. So I'm going to explain some of the things that happens once you start the search, some things that can help you, and then maybe a little bit about what happens when you meet with someone for the very first time, when you finally find someone and wants to go with them. I'm going to start with having access to this care, access to mental health care. So whether you have insurance, if you don't have insurance, or if you have insurance that maybe has, a little bit of a coverage, but not so good. So if you have insurance, the best place to always start is to pick up the phone and talk with an insurance person, someone who's on the other end, and ask them questions about your mental health coverage. You can ask them questions about, first of all, do I even have a coverage for mental health care? What is my copay? That which a copay means how much do I have to pay each time I go to see a therapist? Is there a deductible? Deductible is the amount you have to pay out of your pocket before you're able to, before your insurance pays. So do you have a deductible for your mental health care, and has it already, or for your care, and has it already been met? You can ask them if they would let you, if they have an in-network, meaning a group of therapists or care professionals that they work with, that they can send you a list of, or if sometimes some insurances cover out of network, meaning people who are not in that network, people like myself. So I don't work with insurance. Would they pay you if you went out of their network and, for example, work with me? Are they able to reimburse you for the money that you pay me, for example? So those are good questions that you can ask them. You want to always ask them to send you a list of people. They can do that. They can email you a list of people that are in network with them. And then we'll get to the next step of that. But that's something that your insurance company can do for you, to provide you with a list of names that is in network for them. Right now, because a lot of therapists and a lot of people are offering telehealth, one thing that I encourage people and I tell them to ask, because usually the way it works is that they put in a zip code, they put in your zip code, and they give you people in your area. Because right now there's a lot of people who provide telehealth. I ask them first to make sure that they kind of click that option. If you are okay with doing telehealth, meaning video or Zoom, um, then ask them to include that option. And that can a lot of times expand to perhaps your state, because in your state, anyone who is licensed within the state that you are in can work with you, and that can maybe give you more options. Maybe you're looking for someone who's more culturally sensitive towards your own culture, and you want to find that, and maybe within the city area that you live in you don't have access to that. Then maybe expanding it within the state can give you more access to that person. So you want to make sure right now that you ask about the telehealth option. And if you another question that you want to ask is whether you need a referral to see a mental health person. Some insurance companies make you go through your PCP, which is your primary care physician, the person you go to for your regular checkups. They make you go to that person and get a referral, so they can do kind of an initial assessment to see if you actually need to see someone. If chances are, if you feel like you need to see someone, then you do, but they need that referral process. So you need to go to them. So ask them that if you do need that referral. And you can always also, if you go for your checkups, if you go to your primary care physician, you can also always ask them for their opinion and see if they know someone that they can refer you to, or what they think of your situation. So this is for people who have insurance. Now, I know that a lot of people don't have insurance, or have insurance that doesn't have good coverage for mental health services. Unfortunately, mental health services, they're not very well covered in a lot of, with a lot of insurances, which is why there's a lot of need for a more affordable, more affordable services in different areas. So if you don't have any insurance, now, if you don't have insurance and you can afford to go, see anybody, and you want to look for somebody, a good place to start is always a search online. You can go to places like Psychology Today. Psychology Today, verifies people. So that's always a reliable source. However, not everyone is listed on Psychology Today. So a Google search, talking to friends, or talking to professionals, or even talking to organizations who may have access, who may know people, who may, have people in their directory, therapists in their directory that they can refer you to, is always a good idea. This is if you can afford to pay out of pocket, but it's always a good idea to ask within your networks if they know someone. Now, what if you don't have insurance and you really are at a place where you cannot afford, to pay much towards therapy, and you really need this, which is the case right now for many people. Um, the best place to start searching is to search community health centers within your area. Community health centers generally, especially if they are, federally funded, which I know it's a word that may not mean anything to you, but a lot of community health centers get a lot of public funding or federal funding from the government, so they're able to give you access to care for a lot lower cost. So what you want to do is you want to search online for community health centers within your area, within the, like, for example, within our area, assuming a lot of people listening to us from Houston area. Harris Health System is one of them. Legacy Community Health is one of them. There's so many other, I know, within the greater Houston area, there's so many other places that offer low cost therapy, but you just have to do the initial search. And I know that initial search can always be the part that makes you anxious or makes you just not want to do it, but you must do that initial part. There is a lot of help available. We're fortunate within our area that we have a lot of help available, but you have to do the first part. And if you don't do anything else, and if you, for some reason, really can't find the right place for yourself online, or can't, find these different community centers that I'm talking about, the number to call would be 211. 211 is a general number, is not for just for mental health, but 211, United Way of Greater Houston area, is a number you can call to get resources really for anything, but mental health services is one of them. So the way it works is you call number 211, it goes through an automated system. Side note, they also have a website where you can put in your zip code and get these resources. But if you want to talk to someone on the phone, then you call the number 211. It asks for your zip code. You will get someone on the phone who then you can ask, say, I'm looking for therapy, low cost, or if there's any place that you know of that offers it for free, can you please give me a list of that? Generally, they can give you like, 4 or 5 numbers. I think they usually try to do between 3 or 5 numbers on the phone. I'm not sure if they can give you, like, they could ask you for your email address so they could send you a list, but because they have that option on their website, I don't know if they do that. But on the phone, they can give you a few numbers that you can call. And 211 works, again, like I said, for any resources. So if you have trouble paying rent, for example, if you are looking for many different things, it covers so many different services. So it's one resource that I always give to every single person who is having difficulty finding help for anything, because they really have a very, very diverse database of resources, and a lot of people are listed there. So if you don't have insurance and you still need help, you obviously deserve to get the help that you need. And we are fortunate enough within the Houston area to have this help available. It might involve a lot of waiting, especially right now. I know that the few community health centers that I'm in touch with, they have a wait list because there is so much demand. But I know that the next place might have an availability, and you just never know. So don't give up in that process. Yes, it can be. I tell people all the time, you have to be a little patient with it. And I know that when you're going through a crisis, when you're going through something difficult where you need support, that patience is the last thing. Patience is the last thing you really want to, tell yourself to have. But unfortunately, that's where we are right now, where a lot of people need help, and eventually you will get to the person. You just have to keep looking, and you have to keep trying and getting on these wait lists until hopefully you're able to find someone. So this kind of covers as far as, like, if whether you have access or how to get access. Now, once you get access, and let's say that you got the list from 211 or you got the list from your insurance company, and now you're like, okay, I have these like 50 names in front of me. How do I know which one is the right person for me to pick? The quick answer to that is you won't know from looking at a list who's going to be the right person for you. So don't expect yourself to know by looking at a picture. I mean, the truth is we all try to use friendly pictures where we're smiling and where we look, and that's just how everybody operates. You want to present yourself well. So someone who presents themselves well is always a good indication. If you have someone, I don't know, like if the picture doesn't speak to you, okay, you know, if it looks unprofessional, then maybe that's not your person. But I'm just overall, I'm going with, don't assume anything by the picture. However, there are some things that you do want to look for. So I want to kind of, because a lot of people ask, you know, when they call it, like, okay, are you a psychologist? Are you a, you know, what is the difference between a psychotherapist and a counselor and this? And so I want to kind of explain the difference between these. So when you think of therapy, let's say you want to go to, you say I want to start therapy, which is the term that's used, you know, widely. You can see different people with different kinds of licensure, with different kinds of titles, who can still help you with the same thing, who can still provide you with the therapy that you need. Within this range, within this umbrella, there is licensed professional counselors, which are called LPCs for short, which I am one. And then there is licensed marriage and family therapists, which I also have that as well, who are marriage and family therapists, which basically look at, you know, their perspective is a little bit different, to where maybe they look at problems in a more systemic way, which is how generally I look at problems. In a systemic way means at different levels, in community levels, family level, individual level. There is licensed clinical social workers, LCSWs, who can provide therapy. Psychologists are people who have a PhD or a PsyD behind their name. They can also provide therapy in a lot of cases. In some very rare cases, psychiatrists also provide a little bit of therapy, but I'll get to that a little bit later. But in general, these are within the state of Texas, at least, this is what you're going to see. You're going to see the LPCs, the LMFTs, the psychologists, who are PsyDs or PhDs, and the LCSWs, who are the licensed clinical social workers. I think that covers everybody within our state. Now I'm like thinking, but pretty much when any one of these people can provide therapy to you. So the title, as far as the license goes, is on the client side, it doesn't make a difference, you know, so much as what the title is. Now, if you have family issues, if you're having issues within the family, or if it's, you know, issues within the marriage, then it's better to go to a marriage and family therapist, say. But a lot of LPCs and a lot of clinical social workers also can specialize in marriage and in family issues. So that doesn't mean that you have to go to that person, but that just means that, for example, my education and background was more from that family lens. I did a lot more work on family, so I have a little bit more experience on that, but that doesn't mean that the others don't. So then you want to kind of get to the point where, and this is, I'm right now, I'm just speaking on terms of what's on paper in front of you on your screen when you're looking at credentials and experiences. Then you want to go and kind of look at anyone who has an online presence. If they have an online presence, meaning a profile or a page or somewhere where you can look at their credentials, probably list their areas or areas of expertise, or something where they feel they work more. So you can go there and kind of look and see whatever problem it is that you're having, do they have that listed there? Do they include that within that, included within their list? Again, there is not, for example, if you go to my page, there's so many things listed, and then there's so many things that I do work with that is not listed just because it wasn't included. There's not enough space. There's so many different kinds of problems. So you don't want to just go with that, but you'll get a general sense of whether you connect with this, or you think this person would be a right fit for you or not. And you might do all of these things and still not be sure, like, okay, well, fine, the person is LPC or LMFD and they work with all these problems. I still don't know. And the truth is, you're not going to know until you pick up the phone, you call that person. Most of the people, I can tell you this with certainty, that most people who have availabilities should offer you at least a 10 to 15 minute phone consultation for free, where you're able to talk with them, ask questions, and they may or may not do just a little bit of assessment to see if you're a right fit to, or if they are the right fit for you. So at the end of the day, you're going to have to pick up the phone, talk with someone, talk with them on the phone, and ask some questions and see what impressions you get. Now, it's normal to feel a little bit anxious to talk to the therapist on the phone. You may not know what to ask them, which I always recommend. At least have a few different questions that you want to ask on a piece of paper written in front of you. Don't just pick up the phone and call. Have the questions that are important to you. Basically the very core of your problem, have that written out so you can tell them, this is what I would like to work on, or this is the problem I'm going through. Do you work with that? Do you feel comfortable working with that? If there is anything that makes you question, is this person the right fit for me? Ask on the phone. That would be your chance to kind of get to know them, see how you feel, go with the connection that you're able to make on the phone with them. And then that should give you a better idea of, is this person right for me or not? So again, what's on the paper or what's on your screen in front of you, whatever you read about them online can give you a good idea as far as who you need to see, but then pick up the phone, call them, or email them, whatever way that they tell you, email them and ask, for the consultation to see, you would like to speak with them to see if they're a good fit. And, then on that phone call, you should get a better idea of, is this person right for me or not? You can absolutely shop around until you find the person that fits for you. I know the process can be a little bit, it can be overwhelming. How do I know especially if you're someone that maybe has experienced any sort of trauma or something where trusting people is harder for you? This process can really be, it can be anxiety provoking. It can be overwhelming to a point where you just want to avoid it all. Take a step back whenever you feel overwhelmed by the process of finding someone. Calm yourself down and remind yourself that you need this help and why you need this help. And then move forward with it, come back to it, call again. So don't stop just because you're feeling, it's normal to feel all of those things. You're going to be talking to someone that is a stranger essentially to you, and you don't know much about them, and you're wondering if they can help you or not, because reaching out for help can always be, it can always be hard. So and the other part to it is, can this person really help me with my problem? So go through the process, make the calls, take a break and then make more calls until you find the right person. A lot of times what will happen is you really won't know if you truly connect with the person until you go to 1 or 2 sessions with them. And, sometimes I know that it can be hard because there's time investment, there is, money investment that you make, but you really, when you sit down in a room or you do a lot of, you do a telehealth, you see the person face to face and you're able to really see your problem and see their way of connecting with you, that's when you will really know. It has happened a lot where, I've seen that with, and I've heard about it a lot, where you go to, 1, 2, or 3 sessions and then you decide this is not the right fit for me. Or sometimes as you go to these first sessions and the therapist hears more about your issues, they may tell you that this is not something that they would be a right fit for you to help you. And that's also normal. That's something to, it doesn't happen that often, but it could very well happen to where a therapist might tell you, I'm not able to help you with that. And don't take that personally, because that therapist is doing you a favor, because if they continue to actually work with you despite knowing that they cannot help you, then that's an ethical issue, to where someone is doing something that they know they cannot. So be glad if they actually tell you that, I think you would be better with someone else, and you deserve to know the reason. I know that for myself, if I'm unable to work with someone, I explain to them exactly why, and I make it very clear as to why I'm not able to work with them. And I try to give them places to where they can go to get that help. I know that part of the process can also be very difficult, but it's a necessary part for the client as well as the therapist to recognize that. So yeah, you go to the first session, and that's really where there's a lot of information gathering. So it can feel like a whirlwind of clients often feel like, oh, I'm just talking, I'm not really getting anything. But that's really what the first 1 or 2 sessions are. It's about intake, it's about assessing the situation, really hearing from the client about different parts of what's going on, asking a lot of questions. So that first 2 sessions are, generally very, it's not weird. It's just that it might not feel like, you're getting a lot of help, just because, you're trying to sometimes condense your whole life in 50 minutes, and that's not, reasonable. So really be patient with that process, and if you have to talk to 10 different people until who's the right fit for you, and give it a try. Don't You might go to 1 or 2 people and decide that they're not a good fit for you, and then you're like, oh, I'm never going to find that person. If you ever tell yourself that, it's just not I'm already tired, I'm just not going to go to anyone else. Take a step back, do some things, do some grounding for yourself, to where you go back to your reason as to why you started reaching out for help. If you have support around you, people who can help you, maybe pick someone for yourself, people who are able to be with you within that process, then ask for their support and maybe their perspective on it too. So that can always be helpful. Someone you trust, someone that you actually have a connection with. You can ask them, hey, this happened, do you think this would be good for me, or can you help me with this, can you just be with me? Sometimes it just helps to have someone with them, although you know best what's the right thing for you. There is also another aspect to mental health services, which is psychiatry services, which is basically the doctor you go to get medication. So I know that a lot of people that I'm going to assume that people who listen to us are from all over the world. So sometimes in different countries, you can go to one person to get the therapy, to get the medication, and to get everything else in between. That's not how it works in this state. So, and a lot of times, like, people come and, for example, call me a psychologist, but I'm not a psychologist. But in other countries, therapists are called psychologists because the word it comes from the word psychology. So they call anyone in the mental health field a psychologist. Now here, though, psychiatrists, who are medical doctors who go to medical school, are the only people who can, in the state of Texas, can give you medication, can prescribe you medication for mental health. Your PCP, your primary care physician, can also do that, but psychiatrists are trained for mental health, for mental illnesses, and also mental wellness. So they're the only ones that are truly specialized in it. So how do you know if you need to go to a psychiatrist or if you need therapy? There's really not a clear 1, 2, 3 that I can give you. A good place to start, if you're wondering if you need medication or not, is always your primary care physician, because access to that is much easier. So you can ask your primary care physician if whatever you're feeling, if maybe medication could help. Now, what they give you may or may not help, and you may still decide that you want to have a more specialized perspective on your problem. So you can always do that. Now, PCPs generally have a good idea of whether you need therapy or if you need to go see a psychiatrist. And I would say it's always safe, and it's always good to go and seek counseling and therapy before you go to the psychiatrist if your problems are not, very, very severe. And therapists can always refer you to psychiatrists in the next step if you need medication. They can do an assessment and tell you if you need medication, and if medication can help you in the process of your healing and dealing with your struggle. So psychiatrists are the people that you need to go for your medication. Therapists can give you medication, psychologists can give you medication, but psychiatrists can. And that's the medical doctor. So that's like you go to your doctor if you have a cold to get a doctor, you go to your psychiatrist, who's the medical doctor. Let's see. Another thing another question that I get asked a lot more often when I work with certain cultures, I'm going to make this distinction because, again, assuming that people from all around the world talk to us, the concept of HIPAA really doesn't exist in other countries. A lot of the ones that I know of, but and the concept of privacy is very different, or the way it's approached when it comes to medical files is very different. So I get asked this question, I don't want anyone in my community to know, or I don't want anyone at my job to know. I don't want anybody to know that I'm seeking help for mental health services because of stigma, because of many different reasons. And I wanted to make this very clear that every licensed professional within the United States is bound by HIPAA laws, which are privacy laws, which means as a client, as a patient, you can expect all of your information to remain confidential within their practice. Confidential means it will not be shared with your mom, it will not be shared with your husband or your wife, it will not be shared with your job, it will not be shared with anyone. Now, when you're using insurance, things can get a little bit murky, especially when it comes to mental health services. But in general, even within the insurance, things need to stay confidential. So insurance can't, for example, like leak the files or do something with the files. Things stay very, confidential, and that's a must. And if that is breached for any reason, it needs to be broken, and I'll give the only reasons why it will ever be broken. But if it's ever breached, then you need to be notified, and if it's ever breached for unethical issues, then you have the right to make a complaint to the board of wherever that person is licensed. So absolutely, privacy is a must when you go to see a therapist, and you should expect to have the privacy. Now, I said that there is exceptions to that, and the only exceptions to the rule of privacy in mental health care is if someone is danger to themselves or to someone else, which means if someone is feeling suicidal, and that doesn't mean that immediately if you tell the therapist that you're feeling suicidal, they're going to call someone. No. If they truly feel that you're actively going to do something and you're a danger to yourself or to someone else, so if you're a threat to someone else or to yourself, then they have the right to break this confidentiality to basically be able to save your life for your safety. In cases of if there's court involved for any reason and the court orders the therapist that you need to give basically give your notes on whatever you have that you've, information about this client, then we all have to kind of go by what the court says and what they rule. And then the third case would be in cases of minors and elderly. If there's any sort of neglect or abuse going on, then those are things that need to be reported to protective services. So these are the only three cases to where your confidentiality can be broken within this state. So you should expect any session, these are kind of like general feelings as you start to work with someone. You should expect to feel comfortable. Now, the process of starting therapy in general is not comfortable. You are going to be feeling anxious. Anyone would feel anxious in the first session, sitting down with someone who they don't know, is a complete stranger, basically telling them about their whole life. So expect to be a little bit anxious, but you should not feel uncomfortable by the way the professional is treating you or by the things that they say. You should definitely not be feeling judged. It should be a judgment-free, a therapy room should be a safe place, a judgment-free zone, regardless of whatever your beliefs may be, whether it's your cultural beliefs, it's your political beliefs, your, you know, societal beliefs, whatever it may be, it should be a judgment-free zone for you to be able to express yourself, for you to be able to really talk about your issues. Because if that's not the case, then you're not going to feel comfortable, and that's probably not the right fit for you. And finding that person that where you feel comfortable with, finding that person where you feel like they truly understand your issues and what you're going through is really the I guess the hard part of this process. But it's not as hard as it might seem, because therapists are trained to be you know, judgment free, and you know, good listeners, and being able to really connect with people. So you know, going through that first step can be daunting, but don't put it off just because of that. Take a step back, calm yourself down however you need to, and then go through that process. And then once you're there, once you're face to face with them, ask the questions, whatever questions you may have, whatever may be going through your mind. Ask the question. Don't feel like you're you know, as long as the questions pertain to yourself and the process of therapy, don't feel like you're being intrusive, or don't feel like it's too much to ask. It's your right to ask those questions to make sure that you're going to be getting the right kind of help. So ask the questions, and then you will get to know better once how that process goes. One last thing that I say is that sometimes, unfortunately, it could happen where you might see someone for a few different sessions, and then the connection that you make you may feel like it's not working out, and it happens all the time. You can talk to many therapists, they tell you that sometimes people just don't show up, you know, they just decide they're not going to show up to therapy. If that happens, to where you've seen someone for quite a while and all of a sudden something happens that you're just you know, you feel like something is off, and you're like, well, I just don't really like, you know, this thing that the therapist said, or I didn't feel good about certain things, so I'm just not going to go. Can I just encourage you at that point to bring it up with the therapist, talk about it openly with the therapist, to see how they respond to the issue that you had? Because you can absolutely be right, and you're probably right about whatever feeling that maybe you had. It could be a miscommunication. Therapists are still human beings. They are not, you know, they're not, they're going to make mistakes. They might say some things that doesn't come off right, but you want to be, before, if you establish a relationship with them, before you completely cross them out and just stop going, I would encourage you to bring it up. And that takes a lot of courage, but that's one of the things that, you know, during first sessions, I generally tell my my clients that if there's ever anything that goes through your mind where, you know, I had caused it, please bring it up in the session, because then we can discuss it, then we can resolve it. And that can actually be a very healing process for both sides. So I encourage you to bring it up. If you've gone through the struggle of finding someone that you connected with, don't just automatically cross them out. If something comes up, bring it up in the session. And I think I covered everything that I wanted to in a short time. And I will open it to questions if there is any.
Thank you, Sister Shahrzad, for a lot of information. But it was all very, very good and positive information that hopefully people can pick up on when they are trying to find and pick the right therapist for them. Now we will start our question and answer session. So if you have any questions for Sister Shahrzad, please text them in the text box. I will start where we're basically talking about picking the right therapist for you, but many folk, especially in our community, still have problems even recognizing mental maladies. Why is it still taboo to admit to speaking with a therapist about mental health? How important is it?
Yeah, I mean, that's a topic that a lot of, for example, doctors from, cultures that are minorities within the US, I talk about, I connect with them a lot because, they see a lot of patients. Really, primary care physicians are the people that see the majority because you will go to the doctor for your cold or for your stomach bug, but, and you don't see anything wrong with that. But when it comes to mental health services, like, no, I don't need it. It's gonna resolve on its own. So I talk with them a lot, and part of my job as like kind of the consulting part of it is with the physicians. And they tell me a lot of times, they're like, within our communities it's much harder to get people to go to therapy. And we're not sure why. It's part of it is people who think they don't need it. Part of it is the stigma of, well, there's nothing wrong with me, I can get over this myself. Or that, I have a good support system, I'm going to be able to get through this on my own. And I think it's complicated. I definitely think it's changing for the better, to where a lot more people are becoming open. I've seen that actually happen from within the countries, because I am involved and I'm in touch with a lot of different people who are working within these countries outside of the US. So I'm seeing it change for better, and I'm so glad to see that. But there's still the stigma. We're seeing a lot more even within the US for majority ethnicities and races, and you see that still being is stigma and stigmatized. And we're seeing now a lot more talks, especially with the pandemic. It's like so many more people finally realize, oh no, I can get through this on my own, I really do need the support. And when we talk about support, it's not just therapy. It really sometimes takes a whole village. Say it takes a whole village to raise a child, but really for well-being, it takes community, is what I'm going to say. And we're seeing a lot more talks about it. A lot more well-known people are making docu-series about. You're probably hearing a lot more. Oprah has always been like the on the forefront of this, but now you're seeing Prince Harry talk about generational trauma, and it's like people had probably never heard of these terms of generational trauma and what that. But when people like that start to talk about it, people start to take notice about it a lot more. So I'm glad that that's happening. But I think that within families, within cultures, it's always going to take a lot of education. It's going to take a lot of work from us, from therapists, to reach out, to really be able to open up. This is one of the reasons why I picked this topic, because a lot of times it's not explained how this process works. So there is this fear of, and it's a justified fear, because if you don't know, you think, if I go to a therapist and tell them I want to kill myself, I don't want to wake up in the morning because I have all of these issues, what are they going to do? Most people think they're going to be put in jail. And why should I do that? I'm not trying to cause more problems for myself. So I'm not going to go and tell them. Or, if I have been feeling down and depressed, not wanting to get out of the bed, not wanting to do, anything throughout the day. I have a job, I'm working all day. So I'm able to take care of myself in that way, but I don't want to do anything else. I should be able to get over it. I'm living this life in the States, and I have food to eat, I have a job. So I'm feeling depressed, I'm going to get over it. But then things keep going the same way, and you're not getting over it, and you keep telling yourself that you need to get over it, and it doesn't happen. The moment that you kind of realize how much of your life is being interrupted by these feelings, these overwhelming feelings, or things that are just really maladaptive, and they're not working for you, they're really not making you deserve to feel. You're not going to be happy all the time, but you deserve to feel comfortable in your skin wherever you are, however, whatever your situation may be. And when you feel like that's not the case, then you deserve support, and that support can be professional support. It doesn't always have to be professional support. Community comes in many different ways. You deserve support, and you need to get support. How you get that is going to be up to you. There's going to be some things where the community of your family, the community of your friends, community of your mosque or your church can help you, and there's going to be some things where they can't help you, so you have to get professional help. And hopefully within those communities there would be somebody who's going to tell you that you need that. And the only thing I can say is that stigma changes with every single one of us being a voice to for the really the opposition. I'm going to call it, the person who is going to speak up and say, it's okay, you can do this, this is very normal that you're feeling this, but you can get help, and there's nothing wrong with reaching out for help. So every single one of us, within every family of 20 people, I'm sure there's one person, that person might be the youngest person, currently struggling, having struggles of their own, but that one person can really make a difference of changing the perspective for many people around them. So that's the best that we can do. And then one by one, that's how cultures have changed. That's how I've seen really cultures within these other countries really change, by people really being more open about it, openly talking about these experiences that they've had, and then others recognizing, oh, so it's okay that I'm feeling this way and I can get help.
Very good. Do you necessarily have to have a severe problem to talk to a therapist?
No, you don't. And I get asked that question a lot too. Like, I don't feel like there's something really wrong, but I feel like I want to go to therapy. And therapy, again, can be a place of support in many different ways. It might be just a regular struggle of just daily anxiety, like low grade anxiety or low grade depression can affect your life in a lot of different ways, and you're functioning really well and you're doing a lot of things, but that low grade anxiety and depression can really interfere with some things if you think about it. So no, the problem, actually, you don't want the problem to be so severe before you reach out for help. So if you recognize something that maybe you want to work on, and you feel like you have you can access getting professional help, why not?
What should you expect in the first few appointments with your new therapist?
As I explained, probably the first one or two sessions, sometimes even three, but usually one or two, is going to be a lot of information gathering. So now for myself, so usually a therapist will give you like an intake form before the session to fill out. So you're going to fill out some form, so they have an idea as to why you're coming in. But then during those first two sessions, there's going to be either a lot of question asking. So some therapists do it more formally, to where they ask you questions about different things, about your background, about your habits, about your behaviors, about your sleep, about your eating habits, about your alcohol use, smoking habits, about your family, your living situation. Typically intakes involve stuff like that. Now myself, I like to do the first two sessions a little bit more informal, just because I don't like the question and answer type. So I allow the person to really explain to me why they're coming in, and I tell them that in between I'm going to be asking some questions if I need clarifications, or if there's some things that I want to know more about. So it's going to involve a lot of talking on the client part, because we're trying to, again, gather a good picture of what's going on. Some therapists will give you, within those first one or two sessions, will give you a treatment plan, and a treatment plan is something that basically what your goals for therapy, and then what you're going to be working on. Now, if they give you and show you that treatment plan, you want to make sure that that's something that you agree with, because the treatment plan should work for you, not for the therapist. And you want to make sure you read through that and you're like, yes, these sounds like good goals. Sometimes you go in with 20 different problems, and it's important to be able to prioritize, because you can't work on 20 different problems at the same time. You want to kind of pick sometimes this is the question I ask: what are your top two things that you need to work on right now, so that we can kind of focus, because we can't just kind of work on everything. So yeah, there's going to be a lot of question asking. If it's not done online, then that first session might involve, like, if they give you actual papers which still some people do. It's going to be a lot of reading through pages and signing documents, informed consent, privacy notices, the intake form. So there's going to be signing of some of those, and then lots of questions. And it's also the first, 2-3 sessions are also chances for you to ask questions. So you can prepare beforehand and go in and ask those questions. I always actually recommend that. Sometimes people don't do that, and it's okay. It's not a big deal. But after the first session, if they haven't done that, I encourage them, think of some things that you would like to work on now that you're here. So that way we can address them next time.
And finally, if you've successfully selected the right therapist for you, what are the factors that determine how long you remain in therapy?
Yeah, that's always a hard question to answer, and I can't give you a number. No therapist can give you a number until they have a good sense of, what you're working with. So it just really depends. I can't tell you. And people come in and ask, so how many sessions do you think I need to come until this problem poops away? And I tell them, I really don't know. So I can tell you what it depends on. The therapist is only working for you most likely for 1 hour a week, if not every other week, if not once a month. So that 1 hour really is nothing compared to the rest of your day that you're going about. So it's going to involve on a lot how complex the problem is, and how much work you put in outside of therapy, and how many changes are you able to make outside of therapy, and what kinds of changes do you implement outside of therapy. So it depends on a lot of different things. I would say I haven't seen a therapy session that was a therapy progress that was resolved within, say, like 4 sessions. I mean, it happens, I'm sure, for some things, but yeah, give it some time. Don't rush yourself. Now, I do understand the financial part is always, kind of, the financial is really what plays into this. Also the time, but really mostly the financial part. You just have to be patient, and also again, there's lots of variables on how long it will take.
Okay, then I'd like to thank Sister Shahrzad for her presentation. There was a lot of good things that you can mine from just this topic, and we could go on and on talking about this topic. It's very important, and thank you all for tuning in to Family First Center's weekly Wednesday webinar. Be sure to meet us here each week, where we will be discussing a different topic every Wednesday at 11 a.m.
Thank you so much.
Thank you.